Forever Young Radio. My name's Raleigh. I am here with Bob Gilpatrick as usual. Bob, how you doing today?
Very well, thanks, Raleigh. How about yourself?
I'm doing good.
Great.
I was watching some television, and we've been hearing a lot about aphasia. We've seen a couple of celebrities that have actually been diagnosed recently with this. Wendy Williams is the most recent, and one of my most beloved actors, because people say I kind of look like him with my bald head, is Bruce Willis. And what aphasia is what we're going to be talking about. We're actually going to go over what it is, define it, talk about the symptoms of it, also the causes of it, and some of the things that we can do to help prevent that and many other issues related to it. So that way we can be our healthiest person. Real quick, I wanted to from the Mayo Clinic, I found this. I wanted to read it so everybody kind of gets an idea. Aphasia is a disorder that affects how you communicate. It can impact speech as well as the way you write and understand both spoken and written language. Aphasia usually happens suddenly after a stroke or a head injury, but it can also come on gradually from a slow-growing brain tumor or a disease that causes progressive permanent damage or a degenerative disease. We talk about those a lot. The severity of aphasia depends on a number of things, including the cause and the extent of the damage to the brain. The main treatment for aphasia involves treating the condition that causes it, as well as speech and language therapy. The person with aphasia tries to relearn and practice their language skills, and also has to learn to use other ways to communicate in many cases. Family members, as we've seen, like Bruce Willis's family, very supportive. They play a big part in the process in helping the person to communicate, because obviously if they can't with others, the family kind of understands this new form of communication because they've almost developed it with them so they can communicate. So that's a big part of it. And we've talked about that a lot. A community having support is very important in overall health, but specifically with aphasia, it's something that's really necessary if you want to be able to communicate with this person. Some of the symptoms, I'll just go over those real quick. A person with aphasia may speak in short or incomplete sentences. They might speak in sentences that don't make any sense. They might substitute one word for another or one sound. It can even come down to the sound that the person makes. They might make the wrong, like if they're trying to say T, they might say something like V instead of T. And so it starts affecting even the sounds that the person makes. They might actually speak unrecognizable words. They might actually try to say a word and it doesn't come out right. Have difficulty even finding words. Not understanding conversations. They'll hear people talking and it'll be like Charlie Brown. Wah, 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 wah. And like they don't understand. They can't make that out. Not even being able to understand what they read. So it is like a visual thing where it also affects their ability to visually recognize letters and what sounds those letters would make, and writing sentences that don't make sense. I'm sure there's plenty more, but those are just a handful of them. And within aphasia, there's different patterns, right?
Yeah, so there's numerous areas of the brain that are involved in communication, speech, understanding, writing, and there's also a sequence of events that happens that kind of starts in Wernicke's area, where if someone is going to speak, they actually are making a picture in their mind of what they're going to say first, and then it gets translated into muscular movements in your mouth and your tongue, and that's how that process works in a gross sense. When people start to experience difficulties, it depends on which area or areas of the brain are affected, because if you have a stroke, for example, or a head trauma that causes bleeding or concussion or inflammation, it can affect Broca's area, which is typically known as your speech center. And there's particular arteries that supply blood to that area. And if one of those arteries is blocked or damaged, or bleeds, then Brokaw's area can get affected, but different branch of the artery affects Wernicke's area and like that. So almost every person that has aphasia is different from every other person. But there are protocols and patterns.
So it's a general, aphasia is a general thing, and then there's, with each person, it can affect those different patterns or areas differently. So,
for example, some people may be able to speak all right, but they've lost their ability to write.
Okay.
And which would indicate that Wernicke's area was affected and maybe not at all Brokaw's area and only part of Wernicke's area.
Interesting.
So Wernicke's area and Brokaw's area are nearby each other in the brain, and they're constantly communicating with each other. And there's a bundle of neurons and dendrites that connect the two areas together.
Okay.
And anything that would block that connection is going to create patterns of aphasia, and anything that affects each of those individual areas, even if it didn't block the connection.
Okay.
So we used to work with children in particular in a clinic in New York who were born with various issues of communication in various aspects of their brain. And you would find a child who couldn't read at all, right? But as soon as you put an external electric stim device over Brokaw's area and turned on this mild electricity that they couldn't even feel, all of a sudden they would begin to be able to read.
Interesting.
They didn't have enough electrical potential at the synapses in Brokaw's area for neurotransmission to occur. But as soon as you give them a little bit of electrical help, boom, they can start to read. And then a child might also be having trouble writing, and you could put one of the pads of the machine on Brokaw's area, the other on Wernicke's area, shoot an arc back and forth that would kind of amplify those connections between the two, and a child would be able to start to write.
Okay.
And so this is how you know what's going on. And there's other areas of the brain as well that are involved in that are in a sequence. Sometimes we'd put splitters and connect up other areas of the brain. Also, with some people, language is processed on the other side of the brain as well, on the right side of the brain. And there's communication across what's called the corpus callosum, the part that separates the two hemispheres. So
Gotcha.
Sometimes with a child, you have to put pads on the right side of the brain and the left side of the brain to give amplification to the communication across the corpus callosum. And then you could decipher. We would work with the inventor of the electric stim machine, who was a biomedical engineer, and he was learned in these things, and his advisory board were psychiatrists and neuroanatomists. And then I was in the clinic actually executing the strategies, and with Dr. Liss on the other line reporting back as to what's happening with the client in real time.
So this is using an electrical stim, which we've talked about before.
Yeah.
It's really good to help increase circulation, but what it's doing here is it's giving it that extra bump of electricity, that electric potential that you need to make the connections in the brain.
Yeah, that's exactly what we were doing in a lot of facilities, mostly in New York and New Jersey, started using this device that Dr. Liss had invented for all different things in their rehab centers, including speech therapy. So really big component of helping people with aphasia is to have a speech therapist who's been trained for many years in all these details and with the techniques that help people to regain their speech if possible. Are very highly skilled individuals. I always had professional speech therapists that were working in my nursing homes, rehab facilities that I was the administrator of. Very, very helpful and very highly intelligent people that become speech therapists.
Yeah, one of the challenges I could imagine, not just with aphasia, but with people who have communication issues, is not being able to help them because you can't communicate with what they need.
Yeah.
If they can't
Yeah.
tell you or communicate with you what is the problem, that makes that
Yeah.
problem, the issue, even 10 times worse. So to have the ability to try to, like we were talking, when the family establishes a way to communicate with the person, similar thing in a clinical area, the doctors might have to figure out how to communicate with this person in a whole new
Right.
way.
Yeah, and I mean, there's also a lot of anxiety that goes along with aphasia, both for the person with aphasia and their family and friends, because there's such a struggle with communication. And so a big part of helping people with aphasia is to mitigate anxiety. So you can use havening, which is the most effective technique for that. In fact, there's a form of havening that was created many, many years prior to Dr. Rudin writing the book, When the Past is Always Present. And Naomi Feil was the woman who discovered that people with aphasia who were very old people, meaning 90, 100 years old, tend to get forms of aphasia as they age, and they get a lot of anxiety, and they get very angry, and they'll start pounding on things and repeating phrases over and over again in a very angry tone. And what Naomi discovered is these people were trying to work out emotional issues from their past. And in fact, her movie about this, her first movie, was called Looking for Yesterday. And it was the actual patients she was working with. They were looking for yesterday because it was less painful, or they were looking for yesterday to express their pain so they could try to resolve it.
Interesting.
And Naomi used to use the back of her fingers like this, and she would stroke the person's face with the back of her fingers, and it would calm them down. And as they would calm down, she could then question them about what this word means. So there was a word that was used by a number of people in her research. The word seemed nonsensical, and it was memphens. It turns out what it meant was memorable friends. And the person would refer to their memorable friends that had passed away, and they would call them memphens. And so there became a deciphering almost of the language of old people with aphasia. And Naomi could communicate with these people because she could understand that language, and she could help them calm down and help them resolve traumas that were leading to the aphasia. People that had maybe been abused, things like that. And she would do cognitive behavioral therapy with these very old people. And the next thing you know, their aphasia is gone. Their supposed Alzheimer's disease is gone. It actually was all being caused by this anxiety, emotional upset, an extreme desire for resolution and to be validated as a valuable human being with worth and dignity, even though they were living in a nursing home, which had a stigma, especially back then. But I worked a lot with Naomi. She worked with us on a formal research study, which people can look up on search engines. It was done by the Ringel Institute of Gerontology, part of the State University of Albany, and Dr. Tosland and his PhD staff helped supervise the study, collect the data. The state health department gave us a grant for a few $100,000, and we studied this technique in 6 different nursing homes. And I was the project manager. I secured the grant. I secured the research institute, paid Naomi, brought her to come to the region to do the teachings and the like.
So it was a big thing.
Big deal. She wrote a book later called The Validation Breakthrough, which refers to that research. And it was extremely helpful in helping with late onset aphasia. And there's a lot of people that have aphasia are the old. And it's the biggest category of people with aphasia.
So
We also know, though, that people that have had strokes, whether it's one big stroke like what happened with Jill Bolte Taylor, who's the neuroscientist that had a stroke and lost all function in the left side of her brain and became a completely right brain dominant person, lost the ability to speak, everything.
Wow.
And she, over time, was able to relearn everything. She couldn't remember who she was. She didn't know her family. She didn't know that she had a PhD in neuroscience from Harvard. And she relearned everything and, in fact, went back to school and got a new PhD in neuroscience.
Wow.
And her book is called My Stroke of Insight.
My Stroke of Insight.
And
play on words.
At the very beginning of the book, it's fascinating how she was having a stroke, and because of her knowledge and experience, she knew she was.
Oh, wow.
And she was able to call 911 as it started, and she was observing herself from her consciousness and her right brain, observing the progressive dispossession of her left brain faculties.
Interesting.
And she writes in the beginning chapter of the book, writes the story of what it was like to witness herself losing half her brain.
And that was The Stroke of Insight.
My Stroke of Insight.
My Stroke of Insight by
Jill Bolte Taylor.
Jill Bolte Taylor.
Yeah. So
interesting.
A very, very interesting book, whether you're interested in aphasia or strokes or not. Fascinating book about human tendencies, human capabilities, spiritual capabilities, because she remembers being in the hospital and unable to communicate with the nurses, but remembering everything they said and having this intense compassion and love for them.
Wow.
Because that's the section of the brain that houses those capabilities.
Interesting.
And it was all that was left.
Wow.
So obviously she had a speech therapist, many other types of therapists, a very strong will to recover, and she did.
That was I was going to say. You mentioned the strokes, and that's one of the things that is one of the biggest contributing factors, I think, is strokes.
Yeah.
And so we've talked a little bit about it before, but what are some things we do, right, to prevent strokes?
Yeah, so inflammation is the big one.
Yeah.
And inflammation also is implicated in Alzheimer's disease, which also causes aphasia, and also CTE, chronic traumatic encephalopathy. But strokes quite often are caused by blockages. So a bit of plaque will break off.
And this is plaque from inside the arteries that have been collecting there.
Which can be in your heart, it can be in your carotid artery, it floats into the brain, comes to a junction where the arteries get smaller, boom, it blocks it, and it blocks everything distal to that area. And so we have a whole podcast about strokes and prevention of strokes.
Absolutely. If you go to boomerboost.com and just search the word stroke prevention, you'll get our podcast that we did a while ago. But it's always good to kind of review these things, especially with how something like strokes can affect aphasia, right? How these things cause other things is very important. So it's good to understand strokes, how to prevent them, but what other things you're preventing as well.
Yeah, the other real big one is traumas. Traumatic brain injuries, or TBI, causes aphasia and I've seen many people, very young people to very old people, that have had a brain injury, completely lost the ability to speak and communicate, and all they can really do is make guttural utterances and screams, and it's very distressing, obviously, for the patient. The staff is highly trained how to deal with these types of patients, and very, very difficult while the person is hopefully making a recovery. Some people never do if the brain damage is significant enough, but that is quite often caused from brain injuries from car accidents, falls, etc.
Yeah, and that's another thing we were talking about is the role that falls play in this. And I know it sounds funny, but we talk a lot about the importance of muscle strength and keeping your one of the big things that happens is you stop making muscle, and it keeps it makes you frail, it makes you weak, especially if you're over the age of 50. It really increases your chances for falling and your increase of mortality because of these falls. And aphasia comes right along with a head injury. You're in the bathtub, you lose balance, or you're stepping out and you hit your head, and it could cause a whole bunch of different things. And
Yeah.
so we actually are going to do a show. Our next show, I think we're going to talk about the importance
of muscle in
muscle.
relation to falls and the like.
Yeah, and how big of a deal falls are.
Yeah.
So check that out.
So other thing, Raleigh, when we talk about Bruce Willis, he had what they categorize as primary progressive aphasia, right? And
yes.
It wasn't one thing that happened to him. It wasn't a stroke. It wasn't a fall. It just came about over time. And this is similar to what we talked about with people who are elderly. Eventually, their brain deteriorates to a point where it will affect their communication capability.
Right.
Whatever it was with Bruce Willis, it could have been any type of degenerative disease that was affecting his brain. It could have been a series of mini strokes,
mm-hmm.
which they call multi-infarct dementia, right? Or the tiny little strokes that happen over time, and very gradually you lose abilities. Quite often the ability to speak. Some people will have temporary aphasia, where they have a TIA, which is a mini stroke, transient ischemic attack, and they lose the ability to communicate for a period of time, 5 minutes, a few days,
yes,
and then it comes back because it was a tiny stroke.
I've actually seen that happen.
Right. And tiny strokes can keep going and going and going, and they mimic Alzheimer's disease, because the progressive dispossession of your capability to communicate and do certain functions can be from plaques and tangles in your brain, or it can be from multiple mini strokes.
Wow.
And they tend to
Very
look
similar.
alike together.
Yeah.
Right? But one of the things that we know is effective to help with all types of things that cause aphasia is to reduce inflammation.
Absolutely. That's actually the next thing I was going to say, because regardless of how it happens, all these things are causing us, we talk about this all the time, to burn faster, right? Yeah. And the faster we burn, the less amount of time we have to live, and the more disease and chronic conditions we're susceptible to.
Yeah.
Right.
And we also know that if someone has a fall, injures their brain, or has a stroke, they get tremendous inflammation as a result. And quite often the person recovers at the rate that their inflammation diminishes. So what we like to help people do is, let's speed up the rate of getting rid of your inflammation. Let's get rid of it right now as quickly as possible. You need compounds like trimethylglycine, you need superoxide dismutase, you need glutathione, you need vitamin A, C, E, you need magnesium, zinc, selenium. All these things together will reduce your inflammation and speed the recovery, and also contribute towards neurogenesis. So if someone has a stroke, it used to be believed that adults could not grow new brain cells after a certain point.
Right.
We now know that at any age, people can grow new brain cells.
Actually, we have a whole podcast on that. Go to Boomer Boost and search up neurogenesis or brain cells. And we did a whole podcast about how people over the age of 70 actually have the ability to create new brain cells. Before, they thought once you got to a certain age, that didn't happen.
Yeah.
Right.
And we now know it can. And we also know that the brain can rewire itself. So if it loses capability from one area of the brain that's damaged, it can rewire the neurons to a point where a different part of the brain will take over that function. This is neuroplasticity, and happens, to a degree in every case. And people are constantly rewiring their brains by what they learn, by what they
Beliefs.
communicate, beliefs. This neuroplasticity is happening continuously all throughout your life.
And we've talked about before neurobiofeedback.
Yes.
Right?
Yeah.
And the neurobiofeedback seems like this could be something that would be helpful with this particular thing.
Yeah.
With aphasia, this thing.
Yeah.
With aphasia.
Yeah.
We've talked about all the
no doubt
athletes that we know of that have had massive head injuries.
Yeah.
Right? Boomer.
Yeah.
Not the products. Boomer Esiason.
Boomer Esiason.
And he's one of the ones that, had a really bad injury, didn't think he was going to be able to play. And he was very public about what he went through with neurobiofeedback. Not only did he come back better, but he's still doing commentary.
He still is.
Yeah.
Yes.
So,
still out today.
There's hope there when this type of stuff happens, but it's about being proactive and doing the things like removing the inflammation, seeking, if you think you're having issues remembering and speaking before it gets to the point where you can't speak, see someone about it.
Yeah. Absolutely. The neurobiofeedback issue is really important. We talked about blood supply to the brain, but when there is a trauma, whether it's a physical trauma or an emotional trauma, quite often the brain waves in different parts of your brain will be altered. And so altering brain waves can be very therapeutic. The brain waves that get altered from trauma or stroke is not therapeutic. It's the opposite. So each area of your brain not only has anatomy and chemical reactions that are happening, but there's also electromagnetic waves that are present in different amounts and in different wavelengths in different parts of your brain.
Wow.
And it all goes together. So if you have a stroke or a head trauma, it's very likely that one part of your brain, or maybe even 10 parts of your brain, the brain waves that are supposed to be there, a certain amount of alpha, for example, will get very diminished. And the neurobiofeedback technology can increase the amount of alpha in a specific spot, like Brokaw's area, for example. You'll be able to do that. Parts of the hypothalamus quite often get the brain waves get altered from a trauma, and by wearing a cap that has electrode detectors, they can make a whole map of your brain, how much of which wave is in which part. They can compare it to the norm, and then they can later put a couple of electrodes on the top of your head, a couple on your earlobes, have you watch TV. And what happens is as the brain waves fluctuate in your brain, your brain makes adjustments based on the computer system that is hooked up, the software that's hooked up to these electrode sensors and transmitters are actually making your brain make alterations, increasing and decreasing in certain spots various waveforms. And like with Boomer Esiason, saved his football career.
His life.
He was going to be retired and probably
headed for dementia.
Yeah. So this type of thing is great. In fact, I'm going to a conference that's coming up. I think it's the 8th of March. It's held here in St. Petersburg by the Brain Train Centers.
Okay.
And they have centers around the country that do neurobiofeedback. And they're holding a conference here in St. Petersburg that Boomers is going to have a booth at to show them the technology for inflammation that can go along with the brain train centers.
Right, because you can do the neurobiofeedback and everything, and you can do these things, but that's not going to solve the inflammation issue. Right. And so we've talked about this 1,000 times. Inflammation is the silent killer, right? It is really the precipitous for almost every major disease that we have.
Yeah.
And so by doing your part to mitigate inflammation by eating right, staying away from foods with sugars and processed foods and things that cause inflammation, and by taking in something that can lower that, increasing your diet of antioxidants, especially we have this barley, right? We sell this. This has SOD in it. SOD is what your body normally makes as an antioxidant. It's the master antioxidant in your body, but just like with muscles and with hormones, you make less as you get older. And so you start speeding up faster. So by increasing this, you can really help to elongate your life and reduce inflammation is really the bottom line. And actually, I just thought about it, but we're going to be putting this and Boomer Boost and our lignans on sale.
Yeah, later today,
30% off.
Awesome.
So check it out.
Awesome.
Absolutely. But anyway,
last part, Raleigh, is regeneration of the brain after a trauma requires adult stem cells.
Yes.
You want to grow new brain cells, they originate as adult stem cells. So we have a product called Aphasia Immune on our site, and that helps you to produce and release more adult stem cells from your bone marrow into your bloodstream. They'll migrate to your brain and help with neurogenesis.
Yep.
People that are recovering from strokes do incredibly well when they take Aphasia Immune capsules. They recover much, much faster.
Well, most people don't really realize, of course we make stem cells, but I don't think people really realize that they continually make stem cells, kind of like brain cells. Like, we didn't think you could make brain cells when you get older,
right?
But you continually make stem cells, and that slows down as you get older. So by taking something like what we have here, it's called Aphasia Immune, it stimulates the creation. It doesn't have stem cells in the pill, but it has the ingredients that your body needs to create and proliferate these new fresh cells. And the stem cells, like Anne, one of our resident experts here on stem cells, she wrote a book on it. Stem cells are smart.
Yeah.
They go to where it needs to be repaired.
Yes. And speaking of Anne, also what's extremely helpful for circulation to the brain, which is very important, a big cause of aphasia and dementia, is just simply reduced circulation of blood and oxygen to the brain. And we know the critical component of circulation are pulsed electromagnetic fields that are, these pulses are coming from the core of the earth, they're coming from the sun, they're dilating our capillaries, and these specific PEMFs can be accessed now artificially with what we call a circulation mat that people can lie on. You put it underneath your mattress pad, it's plugged into a power supply that puts out these pulses that mimic the pulses from the core of the earth. Your circulation goes up 29%.
That's a lot.
And can help people a lot. Big studies out of Cornell University about circulation to the brain and dementia and how fast people's dementia improves and goes away if they improve their circulation.
All you got to say about these mats, and this is what gets it for me, NASA uses these mats on the astronauts when they come back from being out in space for so long. Because when you're so far away from the Earth, you're two things: no gravity, no weight. So you're not using your muscles when you're moving things in space because nothing weighs anything. That's number one. Number two, you're so far away from the Earth that these pulsed electromagnetic fields that emanate from the core of the Earth that help regulate circulation naturally aren't there. Right?
Yeah. So your body responds less to them. The pulses are still coming, but your photoreceptors in your mitochondria and in your cells are not reacting as well.
Right.
And so if you use
this mat, the technical way.
If you use this mat, boom, it's right there underneath your mattress pad, and you're getting hit with a lot more of these pulses. So extremely helpful in helping people with dementia, with aphasia, etc.
We're talking space age technology stuff here. Literally.
And there's other things too. The Just Light company has technology that Peter invented. We have a podcast with Peter where we interviewed him about his invention. That also helps dramatically.
Absolutely. And as we kind of spoke in the beginning of the year, as new discoveries are being made in this field of life science, it's only going to get larger. We've spoken to a lot of people, right? One in particular.
A lot of great new stuff coming down the pipeline that we'll be introducing to people that will be very helpful in all of these regards we're talking about today.
It's funny, a lot of the stuff we talk about, you don't hear in the news until 5 years after we've talked about it, because people, they got to figure it out. It's on that edge. So tune in here to Live Forever Young Radio for all the newest in life science and supplementation And we've got a lot of oars in the water here.
We do. And thanks everybody for watching and listening to Live Forever Young Radio Live. We will see you on the next show.